This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals.
Welcome back to another episode of Pretty in Practice, the podcast. Today we have another special treat for you all. We have a special guest joining us, which I'm so excited about today. We have Cheyenne Starner, who is a nurse midwife. And this topic hits home for me because if you haven't been following my journey, I am expecting my first child. So we are going to get all into the details of midwifery, what to think about from pregnancy all the way to vaginal health. Cheyenne's going to help spread some knowledge there. But before we get into all the nitty gritty, we're going to start with our traditional doctor diary question to get to know each other a little bit better. So the question of today is, what is the best Halloween costume you have ever wore?
Me?
Yeah, you can start as our guest. Go ahead.
Let's see. Halloween is my favorite holiday. Like, I love Halloween so much. Ooh, that's a good one. I love, I love all my costumes, but I would probably say the mask. I really liked it because I had like the green paint on my face and my makeup, like everything.
So like Jim Carrey, cool. The mask.
Yes, Jim Carrey mask. So
that sounds cool.
Okay, we got to see pictures of this.
Yeah.
I'm a failure when it comes to Halloween. Every year I miss it. I think the last time I dressed up, it was like back in college days, and me and my friends, we all went as Victoria's Secret bags, and we have like the little stuff in it, and we were like Victoria's Secret presents. Really corny, but that's all we can do.
In college, I went as a Spice Girl with my friends. Yeah.
Oh, that is cute.
That is really cute.
Justice Lay, what about y'all?
I guess the best one, I too feel like dressing up for Halloween. Every year I'm like, I'm gonna dress up and come around, and then I don't. But would have to be like, y'all probably remember, but the Thing 1, Thing 2 costume we wore.
Yeah.
Just because
Amber,
we kind of made it ourselves. So
so
we ironed on this stuff, and I sewed the skirt out of some fabric. So it's kind of like a DIY costume, so I'll take it.
Yeah, I remember that. Yeah, I don't dress up a lot, but I want to actually like start getting into it more. But this year, I would say probably my Kim Possible one because it was so easy. I could use stuff that I had around the house, and it like ended up coming together really cute. And then I just like for the little like thing that when she shoots it or she has, like I had went to Five Below and gotten like, a little toy thing for that, and it looked really similar. So that was fun to do.
Love that.
Okay, cute. Well, if y'all need some Halloween ideals, we gave y'all a bunch, so get ready for Halloween 2023. But now we'll switch over and get into the show. So Cheyenne, can you start just giving us a brief introduction about yourself, your personal, professional background, your education, degrees, all of that good stuff?
Yes. So I'm Cheyenne. I'm originally from South Bend, Indiana. So shout out to the 574. And then I went to Indiana University in Bloomington. And there I pledged TAW chapter. So ski shout out to TAW.
Yes, sir.
And then I went to nursing school after that and did an accelerated nursing program and went straight into labor and delivery. And there I've been a labor and delivery nurse for 7 years. I went back to midwifery school, which is, for those who don't know, there's a lot of different types of midwives, but I'm a certified nurse midwife, which is a master's degree in nursing. So it's like an advanced practice nurse degree. So I went back after having, I believe I had like 2.5 or 3 years of experience as a bedside nurse. Went back to school and did that for 2.5 years. And then I graduated last year in March. And I decided to continue travel nursing. I was traveling locally, and then I decided to just go to Hawaii, be a travel nurse. So I was there for 4 months, and yeah, I was like, go hard or go home, right? I mean, we're going to go somewhere. Why not go the furthest place away? So I went there. So that was a really nice experience to be able to live on an island for a little while. Very peaceful. Learned a lot of different cultures. Then I came back and got settled and just started my new job this month and my first midwifery job. So I'm excited to be practicing and serving the community. In the job that I work, I work with a vulnerable population, so very underserved community. So it's also the type of patients that I served when I was a nurse. So it brings me joy and it's very humbling to me, and it really fills me up to be able to serve people that I really know need my help. They're not treating me like they're entitled and they know better than me, and it just feels so good and makes my heart so warm.
I absolutely love that, especially thinking like the underserved communities and just the disparities that you see when it comes to things like childbirth in those communities. So thank you for targeting that community because that's so needed. And you talked about a little bit about midwifery, and there's different type of trainings you can get for that. But can you give our audience just a baseline understanding? What is a midwife? And another common question that I often see is, okay, midwife, doula, I know both are involved in a childbirth situation. What's the difference between the two?
Yes. So a midwife is somebody who helps you in the actual birth. I don't like to say deliver the baby because pizzas are delivered, not babies. Women give birth, and that's the nature of what amazing things women's bodies can do. And women deliver their own babies because they're strong women, and that's what they do. But in the sense of like what people understand, like the midwife actually delivers the baby. So in my terms, we say like we catch the baby. So we're the actual ones, like our hands are on the baby's head and the head comes out and we're right there delivering the baby, right? A doula is someone who helps you. They don't do medical care. So they're someone who helps you get through birth, get through labor. So they help you, with coping mechanisms. They help you, especially unmedicated birth. They help you, rub your back or help you with different positions, help you with your breathing, help you stay calm, help affirm you and lift you up and make sure that you can do this. They help your partner, your support partner, might give them some tips like, hey, why don't you do this for her? Or, I'll go refill her water while you do this, or just helps you out during labor and is a support to you, but they don't do medical care.
Okay, got it. And do you normally, because with me in my situation, I'm planning for fingers crossed, water birth situation. And with this being my first birth, I wanted both a midwife and a doula, both in the room at the same time for the experience. Do you normally suggest both being involved in a childbirth situation?
Yes, both should definitely be involved. If you like doulas, sometimes some people might not be able to afford one, or if you're in a position where you can only choose one for, financial reasons, or you didn't get one in time, or, your doula was too booked and that's the only one you liked, or something like that. Like, you can do without a doula, and other people can step in that role. But so I would say like a midwife is like absolutely essential, but a doula is a very, very, very close second, like very, very close. Like they're like, so, especially in practices, like I've worked as a doula too. I'm also trained as a doula, but especially in practices where the midwife is very busy sometimes, and I might be, managing you and managing another mom at the same time, where I can't be there for you 24/7. So sometimes I like to be hands-on. So if I'm there, like I'm going to help rub your back and help you get into different positions to help your baby transition, and sometimes the doula has to do that. The doula is going to be there 24/7. Or I might have to step out and go check on this other mom too. So I feel like the doula is very vital. And a doula is good for people who have a doctor too, because some people choose to have an OBGYN and not have a midwife, which is perfectly fine. I'm a very good advocate for doctors as well. And I feel like doulas are very, very important for no matter what type of birth you have, you should have a doula.
Okay, awesome. Okay, so let's switch gears a little bit and get back into midwifery, because I know that not all nurses involved in labor and delivery are certified midwives like yourself. And you started talking about your training a little bit and said 2 years, I believe you said. What exactly does that training look like, and what are the different type of trainings people can obtain to become a midwife?
So my training specifically to be a certified nurse midwife. So we did 2.5 years of school, and then like the first, I'd probably say first like 7 months was like basic, like advanced practice nurse training. So we learned about pharmacology and prescribing meds. Like it wasn't specific towards women's health. We learned about like physiology and advanced physiology, and that was toward the whole body, not just women's health. Like we got to learn about all of these systems, because people come to you for everything. They don't just come to you, for women's health, especially like people in the underserved community. We might be the only provider they see this year. They might not come back for their checkup on their hypertension. They might not come back for their checkup, on their diabetes. They might not come back for this stuff. So we have to be able to know all of this stuff. So we had like very general training, psych, everything, because psych shows up in every aspect of every nursing. Everybody's going to have a psych patient, right? Mm-hmm. So we had to learn very basic. And then the next like 6 months or so was very women's health focused. So we learned about gynecology care, antepartum, which is when you're pregnant, intrapartum, which is during labor and birth, and postpartum, which is after birth. So we learned about all 4 aspects of women's care. And then we start our clinicals. So then we take everything that we know, and then we take it into do on real people. And we had to have 40 births, and then a whole bunch of other like amounts of, like we had to have like 150 prenatal visits, like 50 gynecology visits, 50 pap smears, 50 physicals, like a big long list that you have to check off. And like we had to have 700 hours completely of clinical experience before we could graduate. And then upon graduation, we had to sit for our national board exam. And that's how you become a certified nurse midwife. So there's different pathways. So I'm a certified nurse midwife. So there's also certified midwives and direct midwives. Certified professional midwives, they don't have to be a nurse first, but they can do it's like a 3 or 4 year training to be a midwife. Like let's say any of you right now are like, I want to be a midwife. You could go be a midwife and you could practice, but you wouldn't be able to practice in a hospital or prescribe. So you could practice, you could do home births, but you could go practice and be certified that way. But you wouldn't be like in the nurse aspect.
So with that
and the other
type
one,
of certification, Cheyenne, just really quick, do you have to have an additional healthcare degree prior to becoming a midwife, or can you just, interesting. Okay.
No, you don't. But some of the programs do want you to have some type of experience. Like a lot of them were a doula before, or, something like that.
Okay, nice. All right, so there's a lot of different type of midwives, and there's a lot of different paths to midwifery. And I'm hearing that because I didn't even know prior to you talking that the training is just not about like women's health. That's what I thought it was going to be about. And you had a great segue talking about all the different topics that you learn in your training. So outside of pregnancy, women's health, all of that, what else does your job entail? I heard you talking about like potentially doing hypertension screenings, doing maybe psych. I'm assistant. What else does your job really entail?
Yes. So, women come into pregnancy with a number of things, right? So midwives should typically care for low risk people, low risk pregnancies. They shouldn't be having a bunch of complications. If they have a bunch of complications, a bunch of meds to manage, they should be a doctor patient, because in that case, the doctor has that training to manage that. We can manage, basic stuff. And like everybody has psych stuff nowadays. If you have some type of depression, some type of anxiety, you just want to talk about something, or you're getting worked up about something, we're here for you. And we're here to talk about that. Whether you have to take medication or not, that's fine. You know, we have to learn about that too, to be able to manage that. But a big thing that we do that people don't realize is gynecology care. So it's still women's health, but it's not directly related to pregnancy. So like our annuals, our pap smears, STI screenings, vaginitis, you know, like I have a yeast infection, let me go get this checked out, or, you know, I have new sex partners, I need to be screened for STIs, or I have a weird bump down there, let me go get it looked at. Then they come in for that, and then they say, oh, also, my foot's been hurting, my ears is clogged up, I have a lump in my breast, like, it just spirals, right? So that's why we have to kind of be well-versed in a little bit of everything.
Do you all have prescribing privileges?
Mm-hmm.
Okay.
Yeah, because we are advanced practice nurses, so we have full prescribing privileges.
Awesome. Okay, and I also heard you talk about gynecological health and vaginal health, and the hot topic for ladies is just how to make sure down there vaginal health is A1. And I know you also have your own Instagram page that people can follow. I believe it's midwife Shy, right?
Mm-hmm.
Okay, awesome. That people can follow to get tips. But just overall, from a vaginal health standpoint, what are tips or any type of guidance that you have for ladies listening, just to make sure that we keep it nice and clean down there?
Yeah, so vaginal health is one of my absolute favorite things to talk about. I love it more than pregnancy. Believe it or not, being a midwife, everyone's like, oh, you deal with babies all day. Actually, I don't. I see more vaginas than I see babies. I'll just let you know that. I see vaginas every single day. I see babies every once in a while. So anyways, I love vaginas, vaginal health. It's something that I feel like is very taboo, especially in the Black community. I feel like we're not just talking about like, oh, like this is how you clean the vagina. Like, and like people don't just say vagina and vulva. Like, do you even know what the vulva is? And most of the time when you're talking about your vagina, you're talking about your vulva. Your vagina is the actual hole, not the outside and the lips, you know, the labia. That's the vulva. And so, in some of the stories that I hear, what patients are using down there and how they're caring for themselves after intercourse or after working out or whatever, I'm just like, well, that explains some of the issues you're having. But they don't know. No one knows that, you know. So it's like it's very important to educate. So a lot of my teaching in my patient visits is on perineal hygiene. So how can we better care for ourselves? And some people, I mean, we get down to the nitty gritty. Like, how can you clean your sex toys? Because you keep coming in here with this same problem. Are you cleaning your sex toys? Because you keep reinfecting yourself.
Right.
So definitely using appropriate washes for everything, sex toys. People say like you just need water down there, and that is true. Don't be using, you know, lots of fragrances and everything. Definitely never put anything inside the vagina itself. No douche, none of them like pearls that collect stuff, and none of that, please. Nothing that's tingling and warming or scented, like, you know, none of that. Okay.
I'm glad you went there, because that's like the big debate about cleaning, and maybe the vulva, I should probably say, soap versus no soap, rag versus doing it with your hands. Like, what is your stance? Because you see so many different recommendations on there. So from like a certified, somebody who does this on a day-to-day basis, what is your stance on cleaning your vaginal area?
So my stance is, if it's been working for you, keep doing it. So I'm not going to tell you like, oh, you should not be doing that. But if it's been working for you for 30 years, keep doing it, you know? But the harsh chemicals, and I'm big on like trying to eliminate toxins in general in my life, but the harsh chemicals need to stay away from that area, because your vagina is really a minimalist. She don't need all that, right? So I definitely think your hand only, because whether we like to say that, you know, washcloths are super clean, like they harbor bacteria over time, right? So your hand only. Definitely, like I said, nothing inside the vagina, but cleaning your vulva is okay with soap, right? So we sweat, we go outside on a hot summer day, we take a walk, we go to the gym, we sweat, and that's natural down there, especially, some girls with some thickness, we sweat. So with sweat comes odor. So yes, I would like you to clean with soap if you need to, but don't put it in the vagina, please. Just the vulva, so the outside part. And I wish I had a little, look in here, do I have a little thing to show? But I don't. But just the outside part. And if so, like just a non-toxic soap, and I have on my page like a really good example of a few that I personally recommend. But if it's working for you, keep doing it. If it doesn't work for you and you're continuously getting vaginitis or infections or itching and smelling down there, then we're going to have to switch it up and try something different.
And I think a lot of times too, people forget that the vaginal area needs to be pH balanced, and people don't understand that there's a lot that can affect the pH that we may not even think about. So, I've heard of people saying, oh, well, I'm having, normal intercourse with my partner, and like we're long distance or something like that. And then, he comes back, and then we're, intimate, and now I have bacterial vaginosis or something of that nature. Like, and they're thinking it's something completely different if you guys are following me. But, it could just be that, his body has changed her pH down there, and now she's, having this issue. So a lot of times we kind of forget about those type of things as well. And, that there's good bacteria down there, and then there's bad bacteria as well. And certain things can change the pH that will increase the amount of the bad bacteria, which is where the bacterial vaginosis and things comes from. But it's not always something, that we would normally think that's negative in terms of being down there, but it could just be a certain product, or as you were saying, like a product with harsh chemicals that can alter the pH, and then you can develop those type of things as well. So just something to keep in mind. Yes, absolutely.
Has a big part. It's like big part. You would not even think, but like men who eat like crap and like, drink a lot of, alcohol or soda or energy drinks and put harsh stuff into their bodies, and then they put their semen and sperm into your body, BV, yeast infections, like through the pH, because all of that is like what goes into their semen, and then you have a disaster.
Absolutely. And then the woman's body and your diet yourself, do you have any tips there? Because I know your diet can affect it. And one of the big things that you probably hear in the news is that eat pineapples. Pineapples will make you smell good, make you taste good. I don't know if there's any studies on that or not. But from a woman's perspective, any tips on diet to help our vaginal health?
Yeah, so actually diet is very important when it comes to vaginal health, because antioxidants in general help like plump the tissue down there. So that's like, blueberries, pomegranate, like nice fruits like that help plump the tissue so everything feels better. But pineapple, watermelon, grapes, all of that has water in it, right? So that's what is doing the trick. Being hydrated. It's not per se like pineapple itself. It's the hydration. So having like water intake will help everything. But the biggest thing is also limiting sugar. So sugar intake leads to yeast. Yeast grows with sugar, right? That's how bread is made. Like yeast grows with sugar. So people who have high sugar diets tend to have more yeast infections. Yeah. People who do like sugaring down there to do hair removal, sometimes they have more yeast infections, which we wouldn't think, right? Yeah. That's not necessarily evidence-based. That's just from what I've seen. People who have like diabetes definitely tend to get more yeast infections because the sugar is not controlled well, right? And then probiotics. So probiotics and prebiotics, right? So that's good bacteria. We're feeding the good bacteria like Lay was talking about. So probiotics is found naturally in a lot of foods we eat, but we can also take it as supplements. But naturally in foods like yogurt, kombucha, There's other, drinks, kefir, stuff like that. So sauerkraut if you like. So yeah, there's a lot of different dietary things that we should be having.
Perfect. Okay, ladies, I hope y'all are taking notes. If not, please go visit Cheyenne's page to find more resources on vaginal health, and just make sure that you are taking all this into consideration from your diet, from sex partners, all of that. We're going to switch gears a little bit. I know vaginal health is your favorite topic, but we're going to switch a little bit too, because you are involved in pregnancy. And for me, this is something that's on my mind 24/7 now with the little human growing inside of me. But one thing I wanted to get your thoughts and opinions on is just how childbirth, especially in a hospital institution, takes place now. There's more invasive or modern practices, I guess I would call them, things like continuous fetal monitoring, epidurals, Pitocin, C-sections, all of these things that I feel have been more controversial. And then especially with women like myself considering more water birth or unmedicated routes, we've kind of been reading up on them and trying to decide if these are necessary for birthing situations of a child. So as somebody who's an expert in this field, just wanted to get your thought on some of these modern practices.
Yeah, so I like to say, like, low risk births, typically, are they necessary? No. Sometimes can they be necessary? Yes. And I like that hospitals, especially hospitals that offer hot water birth or even water labor, they offer everything, and they have midwives too. I like that midwives are incorporated in that, because you have both options, right? So if you're there and you're low risk, you're laboring in the tub, everything is going great, you don't need any of that. But sometimes babies have a plan of their own and things go left, and you might need some of that. And you're here already. We don't have to, take an ambulance somewhere and things get scary quickly. And so I do like that it's there as an option if we need it. Now, I do say a lot of those interventions are overused. In my experience as a labor and delivery nurse, I worked 7 years in a hospital setting. I've also worked 3 years in a birth center, and it's overused. I feel like a lot of the physicians don't really allow physiologic birth to happen. Like, they don't allow the body to do what it's meant to do and to do what it's supposed to do. They treat it as a medical process instead of just a natural process occurring. And they just are quick to be like, okay, well, she needs a little bit of Pitocin. How do you know? Did you give her a chance? Like, I feel like it's quickly overused, but I'm glad that it's there in case we need it. Because, sometimes
I agree with
need it. It's been 24 hours, they still 5 centimeters. In 24 hours, your body should be, like, according to studies, it should be changing quicker than 24 hours, right? So at that point, something has stalled, something is not going right, so maybe we need to help you out. But it's
I
just
agree
overused.
with that. Yes, absolutely. And for me particularly,
really,
and I chose the situation.
Educated on it.
Yes, and I chose the situation for me that you were talking about having a hospital birth that actually offers water births. And for me, I went back and forth, and I was like, I do really want to feel my body do what it's supposed to do. I know that it has been programmed to do this by design. It's not something that's a fearful experience. It's something that was intentionally done, and I have everything needed to do this. So for me, I kind of wanted to do the home birth, but then I got a little scared, if I'm being honest, and I wanted all these additional services to be there in the case that I do need something like Pitocin or C-section, because you just never know what can happen. So I'm in the same agreement with you that, it's nice to have this. In some situations, they are absolutely called for, but for me, I personally chose the route of trusting my body and wanting it to do what it was designed to do.
Yay. I love that for you.
Thank you. Okay, so I have another question. So for those like me who are either in the process of about to have a child, or people who are family planning and potentially about to be pregnant and go down that journey, What advice do you have in terms of searching for a healthcare provider? And more specifically, how do you find a good midwife?
Yeah, so I always say like word of mouth, first of all. So like, oh, my friend India just had a baby. Who did she go to again? Let me see, because maybe she liked them, and India be like, no, I did not like her. Please do not go to her. It was a terrible experience. I don't want anyone else to experience what I went through. Mm-hmm. Or she would be like, I really felt comfortable. I felt, I felt cared for. I felt listened to. I would love for more people to experience that. Please go to her. So word of mouth is the biggest thing. It's hard getting on like Google or something like that because everybody's experience is going to be different on there. And you don't know what these people look like, right? So I say that in the sense of, I'm not probably going to ask a rich white woman who she went to. I'm going to ask somebody who looks like me, who comes from a similar background as me, who they went to, because her experience is not going to be the same experience as me. Her experience is not going to be the same experience as someone who's, below the poverty level, immigrants, or any of those situations. Their experiences are not going to be the same. We just know that from racial bias and healthcare bias. They're not going to be treated the same. Right. So we don't know what the people online look like. So how can we say like, oh, she's got all these good ratings? We don't know.
That's true.
So word of mouth is huge. But one thing that I always say, some practices, they'll let you do consultations, right? So I've had some people be either early pregnant or thinking about becoming pregnant. And this is when I was in school. So some practices do it like this, and they'll have like a consultation. So it'll be like a 15, 20 minute like meeting, and you'll like get to be like, oh, this is what our practice does. We have 4 midwives. Ask us questions. We ask you questions. Get to know us, see if you like us type thing. And some practices don't do that. Like we're just too busy. We're too busy to do that. But in that case, what I recommend is doing a preconception visit. So like a gynecology establishing care preconception visit. So in that visit, you can say like, hey, I'm trying to get pregnant. Use that visit to interview your provider. Like, what would that look like? What does your practice look like? Ask them all the questions that you want to know for what would make you feel comfortable with your midwife. Also use it obviously for healthcare tips. Like they'll tell you to take your prenatal vitamins, make sure your partner is taking vitamins, and make sure you're both having a balanced diet and exercise, and limiting toxins like drugs, alcohol, and tobacco. All of that stuff comes in the preconception visits anyways, but use that visit to like interview them about the practice.
I love that because a lot of people don't think of that. When you go to any type of healthcare provider, you just kind of feel like, oh, this is what I have to stick with. This is what's close to me. But you don't think about actually interviewing and trying to find out if the provider is right for you. And I know I did that with my practice, interviewing the midwives and also interviewing the doula. And it is super important because sometimes what you want and what they want and their guidelines and their rules of how they do things around childbirth does not line up. So you just want to make sure that you're choosing somebody that's right for you. Yes.
And the pediatrician. I always say, please go interview the pediatrician while you're pregnant so that you're not scrambling when the baby's already here to find somebody and then, oh, I don't like them. I got to go somewhere else. And interview while you're pregnant. You
just put that up top on my to-do list because it's been hanging there, but I haven't got around to it, but I'm going to make sure before June, I'm definitely going to do that. I know we're coming up on time, so thank you so much, Cheyenne. Like the wealth of knowledge that you just provided has been absolutely amazing. We appreciate you coming on the show to share information just about women's health, about midwifery as a practice. And if anyone needs to find additional resources, like I said, please visit the page midwife. Is it midwife_Shy or is it just midwife Shy? Midwife_Shy.
Yep.
Okay. Awesome. Well, thank you so much. And for all of our listeners, absolutely. For all of our listeners, I hope this was a special treat for you. And no matter your journey through life, just always remember to keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.